what do you do? I mean, basically, don't doubt. The American Heart Association tells us that don't let yourself die of doubt. Basically, that's the message. Okay, so don't say, okay, if I have this, this could happen. If that could happen. If you have any doubt, just go ahead and call 911, especially if one has had, some sort of chest pain or heart problem, and there is underlying COVID, infection. If there's no COVID infection, even then, patients should take this very seriously and consider, getting to the nearest hospital as quickly as possible. And what studies have found is over the last year is that in the early pandemic days, this is a very important take-home point because we learned through this process ourselves. Heart attack visits to the emergency room fell by 1/4 and stroke risk by 20%. Why? Because people were just fearful. They did not want to go into the hospital. They were scared. In fact, the Harris poll from the AHA, that's the American Heart Association, found that almost 28% patients with symptoms of heart attack or stroke would rather stay home from fear of getting COVID at the hospital. That was such a bad myth. But we learned as we went through the pandemic that, the ERs are safe, the hospitals are safe, they're taking their PPE precautions, they're making sure that people are kept safe, they're keeping the COVID patients away from the non-COVID patients, they check, they screen. So these are things that you have to be aware of. Don't be afraid. If you have a serious chest pain, anywhere more than 5, 10, 15, specifically 30 minutes, you have to get to the emergency room. The sooner is better. Time is muscle. That's the message.